Hello, we're Katherine and Saprina from the University of Warwick, and our study was looking at news coverage related to service delivery and organisation of the National Health Service in British online newspapers. The NHS is a major topic of news, with online newspapers having entire sections dedicated to health. In this study, we've looked at the way news about the NHS is reported, both in topic and style, in major online newspapers. We chose these because the internet has grown and become more accessible, and now these papers are easily and regularly accessed. The media is often the public's only point of access for information about the NHS, so it's important to understand how it's portrayed, both in the way it's spoken about and the subjects covered. We knew the type of newspaper can influence the content and style of what is reported, so we looked at both left and right-wing newspapers and both broadsheets and tabloids from these categories. So we looked at 5 of the most popular newspapers in the UK, sampling up to 10 articles from January, April, May and October in 2019, going from the start of the month and chronologically through. This led to us having 278 articles covering both primary and secondary care. We used the search engine on each newspaper website to find our articles, looking at them, articles tagged with health and NHS, for example. To be included, they had to meet the criteria of being about one of these 5 topics, for example, workforce or funding, and then they were analysed according to impartiality, and this was influenced by if there was an opposing point of view, a plan for change, and if the language was inflammatory or balanced, the political slanting, and if it was a broadsheet or tabloid, and whether there was a positive, negative or neutral outlook. So coming on to this next slide, you can see that we obtained a lot of results from our study. From table number 1, some of the more interesting results are that the Daily Mail had the largest number of articles, that was 26% of the articles we analysed. There was a largely negative outlook from the articles, and 82% were negative, and the majority were not impartial, and only 46% were categorised as impartial. Quality and safety and access to care were the most popular topics, and an interview with a staff member was the most popular information source. If you look at table number 2, you can also see that left-wing papers cover topics about funding of the NHS significantly more than right-wing, and tabloids use interviews with patients or their family and friends significantly more than broadsheets.
As we can see in this table, there is no statistical difference between outlook or partiality and whether the newspaper is traditionally left or right-wing. However, when looking at the newspaper type, tabloids were significantly more negative, whereas broadsheets were more impartial in their reporting. Overall, from our data, we have found that the majority of news articles reported a negative outlook regardless of the political stance and type of newspapers. We concluded that this might reflect the newspaper's roles in voicing public's concerns and that negative events tend to be considered more newsworthy. Throughout the newspapers, we found that both primary care and secondary care were well covered. We found that political stance influenced the topics discussed within the articles. For example, articles of a left-wing political stance were found to discuss funding more frequently than articles of a right-wing stance. It could be argued that these newspapers would be more likely to discuss the current funding that the Conservative government is providing and report on how a left-wing government would fund it differently. Newspaper type influenced the information sources used. For example, tabloids used more patient interviews, and we thought this might be due to them attempting to be more relatable to the audience. It is difficult to conclude how media influences the public's perspective of the care provided by the NHS, and this would be something that is beneficial to gauge. It would be useful to correlate our findings with public opinion on the issues we were sampling, for example via the use of surveys. Future research could also include a longer time span and over more than a year, more newspapers being sampled, and a distinction between what the articles were positive or negative about. For example, whether the article was negative specifically about the care given, or more about the funding provided by the government, which then had a knock-on effect of the care being then given. On behalf of myself and Saprina, I would like to thank you for listening. If you have any questions or comments, please add them as a comment below the video and we will read and respond. Thank you very much.